Hi, I'm Michelle, or Mickey Lucraft. I'm a clinical mental health counselor, or an LPC, in the state of Connecticut, and I have a holder certificate in advanced trauma-informed clinical mental health counseling, as well as certification in accelerated resolution therapy and perinatal mental health disorders. This is a brief video about trauma-informed clinical mental health counseling. When considering working with trauma, the first thing to understand is, what is trauma? Trauma primarily involves the emotional response to overwhelming experiences rather than the events themselves. And it can lead to significant changes in the brain and can be misunderstood, as it largely depends on individual perception and reaction. Counselors often classify trauma into two types: big T, which are life-threatening traumas, and little t, which are seen as less severe but are still distressing. There is also what is considered adverse childhood experiences, or ACEs, which are experienced during childhood. Another important thing to consider is the counselor should understand the neurological responses to trauma. So some key terms to look up in this area would be the window of tolerance, optimal arousal zone, hyperarousal, hypoarousal, fight, flight, freeze, or fawn, or the concept of flipping your lid. Now, documentation is something that can be tricky when it comes to trauma, because so understanding the differences between complex PTSD or disorders of extreme distress, even though they're not in the DSM, they're something that are important that you need to document. These are some effective methods to working with trauma clients: mindfulness, EMDR or ART, sensorimotor psychotherapy, EFT tapping, and restorative properties of nature. You want to be sure to incorporate the 9 domains of integration, which is consciousness, vertical, bilateral, memory, narrative, state, temporal, interpersonal, and transpiration. So although some cognitive methods do have significant use in the trauma field, you want to make sure that you approach trauma with a more of a bottom-up approach rather than a top-down approach. Self-care is extremely important for all individuals, but specifically for counselors working with severe and complex trauma clients, because vicarious trauma can occur to the counselor, also compassion fatigue. So it's important that counselors even may need to get their own therapy to help them through this. When considering a trauma-informed approach into treating clients, an intervention should be sure to consider the 6 key principles. These principles are safety, trustworthiness, transparency, peer support, collaboration, empowerment, and cultural gender issues. It is important to remember that when having a trauma-informed approach, much of the approach can be bottom-up rather than top-down, meaning that helping individuals recognize and regulate their somatic responses can be helpful. Just like I gave that example with the flipping your lid, this can be done while focusing on the key principles. And the client could be taught different things to help them ground before we work on the cognitive part. If trauma work is something you're interested in doing, I encourage you to look further into these specialists in this area. Although some of the small mindfulness practices and grounding techniques you can use currently, some such as EMDR, ART, and some of the other methods require more intensive training. So I encourage you to do that, or line yourself and network yourself with other people that are skilled in that area where they can help you out, or you can refer to. But overall, I hope you enjoyed this brief presentation, and if you have any more questions, please reach out to me.